Hi, folks. The Friday after Labor Day, so it's time for a COVID-IN-Cobb checkup. We're going to check in with Dr. Janet Memark. She's the head of Cobb Douglas Public Health here. For the last couple weeks, she's been telling us the numbers have been trending down, and they're going in that same direction.
We're doing all right now. So we have just over 18,000 cases in Cobb County, and unfortunately we have 409 deaths. And you know, previously I had mentioned on a call yesterday that we had seen a lot of deaths in the nursing homes and long-term care facilities when the pandemic first started. We are continue seeing some of those, but we're seeing a lot more in just in our general population of people who are advanced age and have some chronic medical conditions. So I want to make sure everybody is aware that it's still out there trying, like getting people that are in vulnerable situations. So I just want to make sure everybody knew that that was continuing to happen. The really great news is that our case rates have continued to come down, and we will wait and see what has happened over the Labor Day weekend. It may take 2 or 3 weeks for us to really see what the effects of that are, but we are down to 200 cases per 100,000 as of last night. I'm really excited about that because I want it to go below 200. We're going in the right direction, and everything has been heading in that direction, including the hospitalizations and as well as the number of cases that we're seeing. And so keep doing what you're doing with the masks, social distancing, washing hands, and staying away from crowds, because that is really helping at this point.
All right, so this summer, the 4th of July holiday was really considered the start of those numbers heading up to a peak. What about this Labor Day?
One of the things back in the surge that we had previously, we had a lot of gatherings at that point, and we weren't really great about masks and social distancing, and we had a lot of large groups that were coming together, and I don't think we have as much of that this time, but only time will tell what will happen.
One thing we've been watching since the very start of all this is the stress put on the hospitals by COVID-19, and that stress continues.
So hospitals are hanging in there. Critical care beds are still very, very low, and that's not all due to COVID-19. But you know, in our area hospitals in the county, critical care beds are low, very low. But the general medicine beds have a little bit of room, but it's definitely not in the green. So we continue to monitor that situation.
Here is an interesting factor too as we head into the fall season, is that the amount of people that want to get tested for COVID-19 seems to have been going way down. Not really sure why, but there's still plenty of opportunity for you to get tested.
We had a little bit of a increase after Labor Day, so we'll see how that pans out. But we have had a decrease in testing, and so we want to kind of review some of that. You know, not everybody has to get tested, but if you need a test, we have tests available for you to get. So if you have not come into any contact with anybody that could have COVID-19, or you don't have any symptoms at all, or if you aren't anybody that comes in contact with a lot of people during the day, you know, maybe you're a frontline worker, maybe you don't have to get tested at this point. But, you know, we are recommending, though, if you have been a close contact, especially if you have any medical conditions or you live with somebody that might be vulnerable, that you get tested at day 10. So we've talked about that before. It takes 2 to 14 days to incubate. But remember, if you come back negative, it does not release you from that quarantine. You got to finish the 14 days. But, and I wanted to also tell people, there's been some confusion about whether children can get tested or not. And so I don't know about all places, but at our locations, especially at Jim Miller and at the Douglas Health Center, children can get tested. And so we will test children, and we will be having the nasal test available in the near future to be able to switch over. But the core testing sites, the outreach that are out in our community at the KSU site and in different locations, they do the self-nasal swab. And so that, and the parents can help with that situation too. So I want to make sure everybody knew that.
We've also been worried about schools. You know, Cobb schools are going in starting October 5th. Some of Marietta schools are already going in, but the big elephant in the room, Kennesaw State University, those kids are back and so far seem to be behaving themselves.
So far, so good. So in our district, schools have been doing all right. And you know, I want to emphasize a big part of that is that they're doing a lot of the preventative things that are needed. So they were able to decrease class sizes, do a lot of increased sanitation, the wearing of masks. These are all really, really important factors to decrease the spread of COVID-19. And so we've been doing pretty good in our K through 12 schools, and so we're knocking on wood. We continue as we continue to get more kids in school.
And if you've been watching any of these in the last few weeks, public health officials, including Dr. Memark, are very worried as we head into the fall, into the winter, that COVID-19 will collide with the flu. But she has some optimistic news on that. She says these things and the 3 W's may be cutting back on the flu.
What we're seeing in the Southern Hemisphere, which has the flu season ahead of the United States, is that they're only having a fraction of cases that they normally have for flu season. And so that is really important for us, because it is thought that a lot of these things that we're doing, wearing masks, washing hands, and avoiding crowds, those kind of things are helping with flu as well. But another very important part of that is the flu vaccine. In Australia, they had an increased number of people that they were vaccinating for flu. And so we're going to get a double whammy of viruses that will be circulating. So you already know what's going to happen. So please get your flu vaccine as soon as it comes out. You can do it at CVS, you can do it at your doctor's office, you can do it wherever, and we're going to be having some drive-thrus that will get you some flu vaccine as well.
And there's been a lot in the news lately about vaccines coming for COVID-19. What's the status about those? Well, Dr. Memark says regardless of the status, the planning is underway.
So we're currently on target for the end of the year to get the COVID-19 vaccine. And we're working with the state and the federal government to get those out. What I know so far is that it sounds like it's going to be a 2-dose series, about 21 to 28 days apart, that the vaccine will roll out. You might have heard about AstraZeneca, and I wanted to talk about that, about the halting of their vaccine trial. And so I know, you can go either way of what you're going to think about that. I am a little relieved to hear that they announced that, because this is a normal part of vaccine trials. And so we don't usually watch vaccine trials as closely as we are right now. But if there is something that happens to a patient, it may or may not be related to the vaccine. So they have to halt things to investigate further to see if it truly is related to the vaccine. And so that gives me a little bit of comfort knowing that their safety measures are still in place, even though they're doing it in an enhanced time fashion. So we're going to wait and see, but we are still on track here to do the dissemination of the vaccine at the end of the year.
And another thing in the news is this thing called convalescent plasma. I don't even know what that is, so let's let her explain it.
Recently, the FDA had an emergency approval for convalescent plasma. For those of you that may know, that is after you have already gotten COVID-19 and you've recovered. So you have some antibodies that have built in your plasma. So it's a great way to help others out by giving some of your plasma so that we can help people who may be having a hard time getting through with COVID-19. So you can go to the Red Cross and go online and go to their convalescent plasma button there, and you can arrange to donate some of your plasma. And it's a great way to pay it forward.
All right, so finally, the trends are all in the good direction. The numbers going down, especially those cases per 100,000 that we really watch here in Cobb. And I know the school districts have been watching that figure as well. That continues to go down. But Dr. Memark says, don't let up.
What I always say, right? So we got fall break coming soon, and we got cooler weather. Please, we're all doing a really great job. So we brought that case rate down, and it's still high, but it's going in the right direction, and that's so very important. So continue to wear your mask and wash your hands, avoid large crowds, and watch your distance. And I'm gonna keep adding things, but get your flu shot as soon as you can, and have a great day.